Welcome back. My name is Ben Simmons. I'm a first-year internal medicine doctor. Last week I talked a little bit about how much residents get paid, different pay structures by which residents get paid, and a few ways residents can make extra cash. Go check that video out if you haven't already. Today I wanted to give a quick update on COVID-19, specifically what's going on with the COVID-19 vaccine trials. Vaccine trials are a hot topic in the news right now, and there are some issues that people have been reading about that are going on, specifically the AstraZeneca phase 3 trial of the COVID-19 vaccine. I wanted to give a quick update on those issues, exactly what it means and what it means for you, and the speed of how quickly the vaccine will roll out. Stay tuned. So what exactly are the difference between phase 1, phase 2, and phase 3 trials? Phase 1. Phase 1 trials are mainly looking at how safe is this drug or vaccine. We're not so much looking for how effective is it at doing its job, just making sure that it's safe when given to humans, and we're going to try it at different doses to see at which doses is it safe. And the phase 1 trials through the AstraZeneca COVID-19 trial went pretty much smoothly, except for the exception of one patient who had a neurological complication that ended up being from a disease that they had that was completely unrelated to the COVID-19 vaccine. Phase 2 trials. Phase 2 trials look at safety on a longer course of time, as well as adding more people into the trial to get a better idea of what's happening in a larger context. And then finally, we have phase 3 trials. That's where we have tens of thousands of participants really looking at how effective is this drug or vaccine going to be on a large scale, as well as continuing to look at safety outcomes and adverse effects to see if anything is going wrong in the patients that are taking this drug. And so all the reports right now in the news are pointing to the probability that the patient in question has a process called transversemyelitis. Now, transversemyelitis is a process in which the body's own immune cells, or cells responsible for protecting the body, are actually starting to attack it in a specific part of the spinal cord or a specific part of the spine. Now, that can be very dangerous and cause a lot of dangerous complications. So it's important that we find out if this patient got the transversemyelitis from the COVID-19 vaccine, or it was just random probability that this person would have gotten it whether or not they were part of the trial. Now, I'm a huge believer that we shouldn't give any vaccine to anybody, to the public, before we know for sure that it'll be safe to give. The flip side of that is making sure that we are balancing our criticism and being realistic. We have to think to ourselves, would I be critical of this vaccine no matter what the result was? If there's now one adverse event, am I going to say, see, we can't get the COVID vaccine because something bad's going to happen? Or if nothing bad at all happened, would I have also said, see, don't you find it a little suspicious that nothing went wrong during this whole vaccine trial? So be real with yourself when you're being skeptical to see, would you have been skeptical no matter what the outcome was? In reality, this clinical trial is working exactly how it's supposed to. We're supposed to find an adverse event, then pause the trial so we can find out if that adverse event was because of the vaccine. And if we do find out that it was, we can go back a step and figure out how we can change that to make it safer. And if it wasn't, we can continue with that trial to continue pushing to move to get a safe COVID-19 vaccine out to the people. Thankfully, the patient that we're talking about is doing well on their road to recovery and will have a complete recovery and be released from the hospital shortly. In the meantime, we're doing our due diligence as a medical community to make sure that we find out what happened to this patient that caused them to get transversemyelitis, and be very critical of the companies running the trial to make sure that they are doing everything in their power to accurately convey everything that they find out that's going on. As a scientific community, we're very competitive. We all like to get answers first and be accurate and powerful in the information that we're presenting. So that's one benefit that the public has, is that we're going to be very critical of one another because we want to make sure that the scientific process is done correctly and give ourselves a chance to be the ones that come out with the most correct information. And that's what peer-to-peer review is for in the scientific community. And that is why sometimes big studies that find these weird results sometimes get recalled and retracted, because other scientists that are critical say, hey, look, you published this, but it's not accurate. And we'll continue to do this with the COVID-19 trials as well. Thank you for tuning in. Definitely subscribe so that I can keep you updated on what's going on with these COVID-19 trials. And as soon as more information comes out, I'll drop a new video. Have a beautiful day.